The frightening part about uterine tuberculosis is how easily the disease can remain hidden for months or even years. Many women are first treated for stress, hormones, pelvic infections, or menstrual problems before tuberculosis is ever suspected. Unlike lung tuberculosis, uterine tuberculosis may occur without severe coughing or obvious chest symptoms, making the disease much harder to recognize early. Routine scans sometimes show very little, even while silent inflammation continues inside the reproductive system. When symptoms persist, doctors often begin specialized investigations to search for hidden causes. Doctors may collect tissue from the uterine lining itself through an endometrial biopsy. These samples can be examined under a microscope, cultured for tuberculosis bacteria, or tested using PCR techniques that detect tuberculosis DNA. In some cases, hysteroscopy allows doctors to look directly inside the uterus using a small camera. This may reveal inflammation, adhesions, or scarring caused by chronic infection. Ultrasound, MRI, or hysteroscopy may suggest abnormalities, but imaging alone often cannot confirm uterine tuberculosis. By the time diagnosis occurs, chronic inflammation may already have affected the reproductive environment. Scarring inside the uterus or fallopian tubes may interfere with implantation, menstrual function, and fertility. Treatment usually involves combination of anti-tuberculosis medications such as isoniazid, rifampicin, pyrazinamide, and entabatol over several months. The earlier treatment begins, the greater the chance of limiting long-term reproductive damage. In certain cases, reproductive function may improve after successful treatment, especially when diagnosis occurs early. Severe scarring may sometimes permanently affect fertility despite treatments. Because subtle symptoms should never be ignored endlessly, especially when answers are not coming. People cannot recognize a disease they have never heard of. And for many women, uterine tuberculosis remains invisible until damage has already begun.